Hello, this is Dr. Kim Jeong-gil. Today, I will lecture about ab-maxillomandibular triangle. Those of you who have learned tweed analysis already know about the tweed triangle. It is a triangle formed by the tooth axis of the mandibular anterior teeth, the FH plane, and the mandibular plane. In MEAW diagnosis, a triangle required for correction is made to refer to the diagnosis, which is a triangle made up of the palatal plane, AB plane, and mandibular plane. This is called the ab-maxillomandibular triangle. Let's look at ODI first. As I've already said, it's a measure that evaluates vertical relationships. ODI is the sum of two angles. That is, it is the sum of the angle between the AB plane and the mandibular plane and the palatal plane angle. In general, palatal plane and FH plane are parallel. So ODI can be evaluated just by the angle between AB and mandibular planes. APDI is the sum of the three angles: facial angle, IB plane angle, and palatal plane angle. Geometrically, this can also be evaluated by the angle between the palatal plane and the IB plane. Therefore, when you create a triangle with the palatal plane, the IB plane, and the mandibular plane, the angle between the IB plane and the mandibular plane is ODI, and the angle between the palatal plane and the IB plane is APDI. The remaining angle of this triangle is the maxillomandibular plane angle, which is 180 degrees when these three angles are combined. Through the triangle formed by the palatal plane, AB plane, and mandibular plane, the anteroposterior relationship of the patient's skeleton can be evaluated relatively easily. In other words, if the AB to palatal plane angle is 75 degrees, it means skeletal class 2. And if the AB to palatal plane angle is 90 degrees, it means skeletal class 3. Once again, the palatal plane is the line connecting A and S, P and S. The mandibular plane is the line connecting gum. The P and S point of the palatal plane is relatively easy to find. However, the A and S point will not be so easy. Also, some patients may find it difficult to draw the mandibular plane line due to antagonal notch problems. The line drawing the mandibular plane may vary slightly depending on the diagnosis method. Tweed analysis connects the tangent to the lowermost mandible, and Downs analysis connects the gonion and the menton. MEAW analysis uses Downs analysis. Steiner analysis connects gonion and gnathion. How to determine the gonion point here? The gonion point is the point where the ramus tangent of the mandible meets the tangent of the mandibular lower border, and the point corresponding to the bisector of the mandibula. However, in patients with open bite and high angle, the masseter muscle and the suprahyoid muscle sometimes pulled forward, causing the mandible to appear bending. This is called antagonal notch. If the antagonal notch is severe, it can be called open bite tendency and high angle case. If the antagonal notch is severe, the mandibular plane is not set as a general gonion point, but rather a line connecting the central part of the antagonal notch and the menton. This can make the mandibular plane relatively steeper. In other words, more than 90% of the mandibular plane uses gonion and menton. But if antagonal notch are severe, use an antagonal notch center and menton. Let's take a look at the palatal plane. The palatal plane is the line connecting the A and S and P and S, and is usually parallel to the FH. The ANS of the palatal plane refers to the base of the posterior alar cartilage, which is usually the most posterior point of the nose. You should remember the term posterior alar cartilage, which is the lowest point of the nostril. For Asians, the posterior alar cartilage is located slightly anteriorly and is easy to find. In some patients, ANS has severe variability. Some patients have ANS 2 up or down. At this time, drawing the palatal plane using only visible ANS can lead to numerical errors. Therefore, in this case, PAC point is sometimes used instead of visible ANS. Usually more than 90% of the palatal plane uses ANS and PNS. However, if ANS is highly deviated, use PAC and PNS. Here are some things to keep in mind when measuring the palatal plane angle. If it is too small than -5 degrees or too large than 5 degrees, it may affect the overall measurement, so adjustment is required. If the palatal plane angle is +7 degrees, this is necessary to check first because we cannot rule out the possibility that we have taken a wrong point somewhere when tracing. However, if it still comes out at +7 degrees, we recommend adjusting to +5 degrees. If the palatal plane angle is -7 degrees, then calculate it as -5 degrees. In summary, the ab-maxillomandibular triangle consists of these 3 planes. The angle of this part is ODI, and the angle of this part is APDI. Also, the other angle is the angle between the palatal plane and the mandibular plane. This is done by subtracting the sum of ODI and APDI at 180 degrees. The sum of ODI and APDI is called combination factor. So the value between the palatal plane and the mandibular plane is 180 degrees combination factor. Ordinary doctors evaluate low and high angles only with the angle between the palatal and mandibular planes. However, in MEAW diagnosis, an AB plane is added, and ODI, APDI, and CF are measured and evaluated. This is because it is easy to grasp not only the vertical relationship, but also the anteroposterior relationship between the class 1, 2, and 3 and their tending skeletons. Next, I will lecture on combination factor. Thank you for watching.